Hello, everyone. Welcome to Nova Careers, where we talk to real people about real jobs so you can discover what's possible. Today, I'm talking with Noelle Adderley, an office manager at a home health company. If you're curious what it's like to be an office manager, this is the episode for you. Good morning, Noelle. Can you introduce yourself and tell us what you do?
Yes, so I am an office manager for a home health company. I've been with this company for about 5 years. What we do in our home health, for my home health company specifically, is we send out like skilled nurses, physical therapists, and occupational therapists to patients' homes to receive care in their homes. These are typically patients who are like getting discharged from a skilled nursing facility or a hospital. We also get like a lot of ortho patients. So those who just had surgery and are typically homebound, so they can't go anywhere. But so that's kind of what I do. We work with an intake team who kind of does like the scheduling, make sure we're contract with the insurances. And then I have my office team also who are following up on like the doctor's orders and taking phone calls from patients, but also like making sure we're in compliance with the patients and the care that they're receiving.
Thank you. What led you to become an office manager?
So I actually started out as an office assistant for this company. And I started out pretty much being like in the receptionist role where I would take phone calls for the patients, um, and also follow up on orders with doctors' offices. And I was actually in this role part time before I had graduated college. And then once I graduated college, it became a full time role for me, and then eventually was promoted to become the office manager.
So you've worked in several of the roles prior to
I
becoming the office manager.
I did. Well, pretty much just like two roles because I went from being an office assistant to the intake team, which is a little bit higher in that role or in like how our hierarchy goes, and then to office manager.
Nice. Did you always know you wanted to work as an office manager?
I did not. I didn't really know what all would be entailed in an office manager. It kind of sounded stressful and like a lot. I actually told my boss when she asked me if I wanted to become the office manager that I was unsure because it seemed very stressful. But here I am.
What education or training helped you most for this career?
So I minored in business management at my school. And so I do think that helped, especially things from when I went to college. I had to take like a human resource class. So I think that was actually pretty helpful to just know because as an office manager, you are dealing with all sorts of problems, whether it's the people you hire or just anything in general. You are overseeing a team, so if there's any issues, it's really nice to know how to deal with them properly. But also for trainings, as far as that, I think just having healthcare knowledge is very important too. If you want to be in the healthcare field specifically, there's a lot of terms that they use in healthcare that would be good to familiarize yourself with. But from an office manager standpoint, I do think having even just like my minor in business management has helped as well.
So is there a certain career education path that you would say is needed to work in this industry, whether it's as an office assistant or office manager intake? Is there educational background that is needed?
I would say, as far as the office assistant role, there's not really much of an education background that you need, other than you just need to be willing to learn. Because I think if you're willing to learn and willing to be trained, then you will exceed in this. And then usually, if we do hire someone who has no experience at all, they eventually become accustomed to how we do things and they also learn. And that kind of leads them into an intake role, which you deal with insurances, which could be a lot. So I would say if this is something you would want to get into, familiarizing yourself with insurances in the healthcare field. I know that it's just It's obviously kind of different from like car insurance and stuff. So health insurance specifically is a good thing to just have some knowledge in. I'm sure there's so many different ways that you could familiarize yourself with how the healthcare insurance field works. But I also started out not knowing anything when I was working or when I started with this company and I learned. So it's not something that's crazy hard to learn. It's just definitely a thing that a lot of companies would rather coming into these roles that you knew.
So there's not necessarily an educational background that you need, just a willingness to learn
Yep.
uh,
Yes.
so that you can succeed.
Yes.
What does your typical day look like?
Oh my gosh. So typically I come into the office and first thing I do is check my email. And we could have a million, not a million, but we could have patient referrals coming through our emails. So we usually check that first thing just to see if we have any new referrals that came over for patients who want our services. And I assist a lot with our intake team just because they're dealing with the new referrals and the new patients. So it can become overwhelming for them. And then also I'll help with my other, I'll call them my orders team. I'll help them if they need help with anything too. But typically I'm pretty much overseeing both throughout the day, helping wherever I can. And then I'm also the main one who follows up on insurances. So if we have a patient who's already on our services and we need more visits like authorized by their insurance, then I'm the one who will call the insurance and get those additional visits that we need in hopes that their insurance will approve them. Um,
What's one thing people don't realize about being an office manager?
I think what people don't realize is that it can be a lot for yourself when you're managing a whole team, but there's also a lot of great things about it. I think you always have to focus on the positive because there are going to be days where it's hard and days that are easy. And I think that can go for any, no matter what job you have, no matter what title you have. And so I think just trying to maintain like a positive environment is something that I strive for in like across my team, across our office, because it can be very easy, especially when you have a patient that needs to be seen like last minute. It can create a lot of anxiety and stress situations. So just trying to remain positive and working together.
Thank you. So, how much of your job is people related versus paperwork or technology? Like, you don't really do you deal with the people or the patients or I guess the doctors that you need referrals from? Is it more paperwork? And yeah, go ahead and answer that one. And then I have a follow-up.
So we use a lot of technology. Any new referral that we get, pretty much everything we use is through Google. So like we use Gmail, we use Google Drive, we use Google Sheets, everything. So we do a lot of spreadsheets to keep track of our patients and new referrals. We also use WhatsApp for communication with our marketing team, with our clinicians that are out seeing the patients. We used to print every single referral and we were killing a lot of trees. So we moved everything to be electronic on our computers. What was your other question?
How much of your job is people related?
People related. So it's very people related. Across, so like we have our whole office team, but then aside from that, we have our marketing team. So we're throughout the day, we're like communicating with our marketing team who are going out and assisting and getting us patients. But the aspect of like, we don't have patients who come into our office since we are seeing them in their homes. So, but we will communicate with them like on a phone call so we can confirm their address, where they live, and things like that, and when they want services to start for themselves. So
So
we are still communicating, just more virtually.
but it's kind of a nice split. You did mention earlier that you talk to the doctor's offices, so you don't see them personally in the office, but you are communicating with doctors and you are
Yeah.
communicating with the patients and the marketing team.
Yes.
What are the most important skills for this job?
I would say the most important skills or knowing how to use an email and also knowing how to fax. Faxing is actually really simple, so it's not hard, and we do it through our emails, but that's definitely something that is easy to learn, and if you're trainable, again, we can train you. We would train people on it, but also another skill would be, I guess, just technology because that's like our main thing that we are using is everything through Google. And I know other companies also have like their own process, but mainly everything is online on a computer.
Well, you kind of maybe already answered this. I feel like you did, but what's one skill you didn't expect you would need, but turned into be an essential one?
Learning how to fax. I didn't
I
know that faxes still existed until I started this job.
Yes, and you probably lost a lot of people when you said fax and they were like, "What is that?"
Thankfully, I don't know how it was back in the day, but now it's really easy. It's pretty much like typing in a phone number on our email and then it sends it as a fax. So it's way simpler than what I ever expected.
It was that easy. Now I think kids could probably relate to just, taking a picture and sending it through your phone via email or something like that,
Yeah.
attaching it. When I worked in an office, a law office, I would fax, but I would use the copying machine, and so I would actually put the document on the
Oh, yeah.
copying machine and then put in the number, and it would send that facsimile is what it's short for, over to whoever I was sending it to. Yeah,
Yeah.
which is yeah, that's kind of what I thought you probably didn't expect. You probably didn't even really know what a fax was before this.
Yeah, pretty much.
That's funny. What's the hardest part of your job or the most stressful?
I would say the most stressful is when we get a last minute patient that needs to be seen in a short amount of time. Obviously, we want to deliver the best care to our patients. We might not always have someone available. Sometimes we do. So that can just become stressful, but we always seem to work it out in the long run. So that's the good part of it is that it does always seem to work out. From the office manager standpoint, I would say the most stressful or difficult part of the job is just dealing with different personalities because obviously not everyone has the same personality. Everyone is different. And so having to work with them and meet them where they're at and also understand like everyone does have different personalities, which is totally fine. But navigating that can be a little hard at times.
I can understand that. How many people are directly under you then?
So I have 6 people under me right now.
Okay. Yeah. It's always tricky I mean, we all have different personalities and we all have different ways that we learn and different communication styles. So all of that, no matter what job you're in, takes skill to work with other people. What advice would you give high school students interested in this kind of work? You kind of touched on it maybe earlier saying, familiarize themselves with the healthcare lingo. And would you have any other advice?
So I actually, when I was in high school, I worked at an assisted living facility just as a server. So I do think just even getting a basic job, even at like an assisted living facility or somewhere in the healthcare realm that'll just hire you to do whatever. Um, it gets you familiarization with the elderly. And we don't work with just the elderly, but I do think it still helps you become familiarized with that world and just how it kind of works together. I mean, it's still an assisted living. We do see patients that are actually in assisted living facilities. So that's kind of cool. Then I have like a bigger grasp of how things work there and stuff.
It's cool that it kind of came full circle like that.
Yeah.
So what was your first job?
My first job was at the assisted living facility working as a server in the kitchen, serving
Nice.
the residents at that assisted living facility their meals.
Did you enjoy that job?
I actually did. Enjoyed it just because I got to know each of the residents pretty well. And I also really like memorizing things. And we had to memorize, like, some of them couldn't have certain drinks, some of them could have some drinks and stuff. And so I found that kind of fun.
Okay. I wanted to ask you earlier it sounds like you work in an office. Are you strictly in the office or are you hybrid or obviously not remote? So,
Yes. So I work in the office. We are allowed like 1 day remote a week. And which is nice. I think I don't know exactly how other companies do it, but it is also a job where you could definitely work fully hybrid. But with our office specifically, we're pretty much in the office and then we just get like one work from home.
and here's a couple fun questions just to end this with. One career you wouldn't want to do.
I would not want to be our nurses.
Okay. Which I was going to ask you also. Go ahead.
I said not at all. Nope. I
I was
tell
going to
them pretty much almost every day. I tell the nurses that we work with that they are real rock stars because I could not do it. It's a lot.
I agree. That's not for me either. What other positions are in the office or in your line of work? Like if other people were interested in working in the home health care industry, but not necessarily in the office, what are other positions available?
So we do have our marketing team who goes out and markets our company. Then so that people can hear about us, and get to know our company, and then that also helps with patients deciding if they want to go with our company or not. And then we have nurses, like I said at the beginning, physical therapists, occupational therapists, and speech therapists that we hire as well. They're the ones who go into the patient's home and see the patients. And then in our office itself, so we have my boss, who's a director of nursing. She is an RN that has a nursing degree, and she's like the overseer of all the clinicians, all of us in the office. And then we have our clinical supervisors, who one's an RN, one's also a physical therapist. One oversees all the nurses, the other one oversees all the therapists. So all the physical therapists, occupational therapists, and speech therapists. So there's definitely quite a bit of roles within the office, but a lot of them are you have to have like a clinical degree for that. Yeah. Certifications.
Nice. Definitely a much needed industry, the home health
Yep.
care, and I thank you for working in that and helping those who do need that care at home get that care that is needed. All right, so here's lighter note. Coffee, tea, or neither?
Coffee.
Coffee black
No. Coffee with milk at least.
with milk at least. And then what's one piece of advice you'd give your teenage self?
I would tell my teenage self that I don't have to have it all figured out. It's okay. And it's honestly, too, what I say almost every day in our office is that I learned something new. And I think it's okay to make mistakes and to learn from it and just always be willing to learn. You can't know it all. So just be open and willing to learn all the time.
Thank you. Well, I thank you, Noelle, for being our guest on Nova Careers, and thank you for sharing with us a little bit about being an office manager, specifically in the home health industry. Thank you for giving us your time today.
Thank you. It was my pleasure.